Hello, my name is Sarah Gill. I'm a lymphedema therapist and I'm here with Medical Rehab today to show you a really exciting way to bandage the foot, which is using a new type of compressive adhesive tape called Biplast. Biplast is a two-arm product and it is a compressive adhesive, so it's very different to other tapes that you might use on the market. It actually has quite a high grade of compression. And it comes in two different sizes. I've got my 10 centimetre roll here, which looks like this, and then also a 3 centimetre roll, which looks like this. They're the two ways it comes. How I use it, and you'll see there's instructions on the back when you get your box at your clinic, is I actually tear it like this. Then I can make some handles on either side. And when I pull it really firmly, you'll see the weave openings up. Then I place pressure on, remove one handle and then the other. And what this actually does is enable the patient themselves, if they need to have their foot bandaged, they can have this on for approximately 3 days. It's reasonably water resistant, but you'd still try and keep out of water as much as possible. So again, I'll explain with the larger type, we rip it, then we make handles, pull and place the pressure on. You'll see what I'm doing the foot. The other way we apply it is with our 3 centimetre, which is this roll here. The 3 centimetre I use more as an anchor. So what I'm going to be doing is pulling a section off. I anchor that on, and then as I go around the foot, I'm going to pull this through. And this is used mostly for stirrups. Now, because it is very adhesive, we're always going to use a protective mousse underneath. And this is our protective mousse. It's a fantastic product. It's great for all physiotherapists out there, or nurses, or any place where you might have to put some adhesive over the skin. What I love about it is when you roll it on, and it follows itself around. So you don't actually need to drag it around the body itself to put it on. Easily rips and adheres to itself. So here I have Victoria, who's kindly being my model for today. Now, we're going to pretend that Victoria has quite severe lymphedema of her foot and also in her toes. I've already bandaged up one toe, and what I've done is use some protective mousse, and then I cut out some small sections of this. This is our 5mm by 5mm Mobiderm. It's really easy to cut into shapes. This is primarily used for the foot or the hand. Then I can continue on and do each toe individually. If there isn't a lot of edema in the foot, but you just want to hold it while you're carrying out some bandaging, you can just do the first couple of layers that I'm going to show you, and you may not need to include the toes. You can also use a cotton flexi-deal over the toes. You've got lots of options. So I'm going to pretend that I've done every toe individually, and now go on to actually bandaging the foot. So the first thing I'm going to do is place this protective mousse around. So I just start over the top of the ball of the foot, and I come round, and you can see I'm just ensuring that there's no gaps. I'm going to come down around the heel because we're going to make some stirrups. And make sure it's all covered. And it will just stick on. The great thing about this product as well is that you can quite easily do it further up the limb if you want. You can just place your hand there and rip it off. So it's very easy to remove in that way. My next step is I've already pre-cut a patch of Mobiderm to put over the dorsal of Victoria's foot. So that's going to sit on there, and I make sure she can still bend her ankle nicely. To make it easier for me to tape over, I'm just going to secure that again with some foam. Otherwise you do end up chasing the bit of Mobiderm around a little bit. And that's going to be nice and secure. So now I'm going to use my pieces of Biplast tape. To measure it up, you'll see I've got 3 here, a small, a medium and a large. And we put these 3 pieces on first. So to measure, I just take my roll and I go from the outside of the foot here around to the inside, right on the arch of the foot, and that's my first cut. I then add 3 centimetres, or I like to think a couple of fingers. That's my second cut, and then to that original size again, about 4 fingers, and that's roughly 10 centimetres. And that gives me my 3 pieces that look like this. So what I'm going to do is try and create a little bit of pressure as I go up by placing the smaller piece, the medium-sized piece, and then the larger piece. And each time I place it on, I do about a finger's width away, and that's going to create a lovely pressure gradient and really hold the foot in well. So I grab my small piece and I rip it, make my handles, try not to drop it. Then I pull, really open my weave, and I'm going quite high up onto the toes, just the base of the toes. Undo my first handle, round to there, second handle to here. And that's my first one. And at this point, the whole of the foot is still uncovered. I then grab my second piece, and I'm going to do this about a finger back, which is here in Victoria's case. I pull, rip nicely, grab my handles, and this one's going to go a little bit further around the foot, so about a centimetre back. I follow the contour of the foot, I pull as strong as I can, come around to there. So this still hasn't quite gone all the way around, and in fact I want to have about a finger's width on the sole of the foot of just skin. So with my final one, again I'm going to go that far up. Now I'm checking where Victoria's ankle bends, because if she had quite a short foot, I want to cut that off just a little bit, because you don't want to have any pinching here at the fold of the ankle. So again, with lots of force, I rip. You can't mess around with this. This ends up getting stuck on your fingers. Make my handles, and here I go. Pull nice and hard, back about to there, and I go around. So now what I'm going to do is create some stirrups that actually are going to hold this in place. Again, if it was just a patient who you wanted to do some holding of fluid, but it's not really a large edematous foot, you could just do the first two layers that I'm showing you of each of them. So now I've got my stirrups, which I've pre-cut, and it's the same principle as before. I've got a small, a medium, and a large. And how I measure this, I have my small 3 centimetre roll, and I go from just under the base of the toe here. Sorry Victoria, if I'm pulling you around a little bit there. And I run underneath and come up to the base of the little toe. And that's where I get my first cut from. From that I then add on 3 centimetres, and from that original again 10 centimetres. And that's how you get your small, medium and large. So I take my small stirrup first, and you always start on the inside of the foot. So I'm going to find just the base of the big toe, and that's where I actually start. I've pulled off my anchor. I've put that on, and now I'll do this quite dramatically for the video. I pull up and I pull it around, and I'm following the contour of the foot. Ask the patient to bend. Then when I get up to the toes, this is a great product that's very flexible. I can roll it around the top, and I have a little tag at the bottom. For the next size up, all I do is follow exactly what I did before, but I do it 50% layer up and about 1 centimetre back, so that we're going to get a graduation, so that when this comes up here, it's actually going to be a 50% overlay onto there. I'll just get Victoria to turn her foot. And I do the same again. So with this one, I'm pulling the strip as I go. The best thing you can do with this product is just practice on yourself and then practice on your patients. And once they've got this on, unlike other bandages, it actually won't slip very much in the shoe, which is exactly what we want, and they can wear a shoe, which is great. Unlike when you get the really big bulky, or if you've got a standard bandaging procedure, that sometimes the bandage will move in the shoe. Now I'm up to my final one, and I just do the same again. I start about a thumb width down from the original and a 50% layer up. We've got some great instructional sheets on how to do this, but hopefully by seeing it in the flesh via the world of video will make it much easier for you to follow. This time, because this is 10 centimetres, I've got quite a bit of space, so I come all the way around, and this last little one is the one that wraps up over the foot, and then I tie it off at the end up here. So that's fitting quite nicely on Victoria. To tidy it up, I've then made 2 small 8 centimetre blocks, and I've done that just by cutting. You'll see the lines on your biplast along one of the lines here, and that's made at approximately 8 centimetres. And this is just to make sure that none of this is going to, catch or start to pull off if they've got socks on. Again, I've just measured by going from the medial side of the foot to the lateral. I do my big rip. The more you do this, the faster you get. And if it's your patient who's getting bandaged, you're only going to have to do it once every 3 to 5 days, depending on how mobile they are. So I just put this nice piece across here. Now I ask Victoria to bend her foot back for me, because we want to make sure that we're not actually going to get into that crease. And just a 50% overlay of this one. Down like that. And here we have the foot with large lymphedema being treated. It can stay on for 3 to 5 days. You can individually do toes if you need to. Otherwise, you can just do the first 2 layers if you want to hold a little bit of compression down there. You always need to use a combination of stirrups and the big pieces. You can start to develop your own protocol on how to use this best for your patients. Thank you.